You're listening to Parents, You've Got This, the expert guide to parenthood. The complete guide to pregnancy, birth, baby and parenthood.
Polycystic ovaries is a syndrome which affects many women and it affects not only your fertility but also your quality of life. Today we're incredibly excited to welcome back our IVF and fertility expert, Dr. Rachel Knight from Life Fertility Clinic here in Melbourne.
Dr. Rachel Knight is a leading gynaecologist and fertility expert who was also the head of the PCOS unit at the Royal Women's Hospital in Melbourne. Thank you so much for joining us today, Rachel, to share your information and expertise about this topic which you know so much about. We are so grateful to have you here.
Oh, a pleasure. Thank you so much, Freya and Christy, for having me along here today to talk about Polycystic Ovarian Syndrome.
Can we start right at the beginning, Rachel, with what is Polycystic Ovarian Syndrome? We hear it bandied about, we hear PCOS, we hear that it's common, but what actually is it?
Yes. What I will do is tell you a little bit about what Polycystic Ovarian Syndrome is, but also what Polycystic Ovarian Syndrome is not, as there are a lot of misconceptions out there about Polycystic Ovarian Syndrome. What it is a syndrome that comprises three different aspects. One, symptoms which include irregular cycles, sometimes no cycles at all or no periods. It also is characterised by multifollicular, which is a better word than cystic, ovaries on ultrasound, and hormone imbalances that can lead to problems such as weight gain, excess hair growth in places where you don't want hair to be growing, and an increase in acne as well. So what Polycystic Ovarian Syndrome is not is a condition where ovaries produce large cysts and a lot of pain. However, often people do put these things together, and the polycystic ovary is really a number of very small follicles that have been probably misnamed as cysts along the way as the condition has been developed.
How common is it?
Polycystic ovarian syndrome affects 12% of women. However, certain areas do have, and certain women do have an increase in the prevalence of polycystic ovarian syndrome. Adolescents have polycystic ovarian syndrome diagnosed in up to 18% of cases and commonly are overdiagnosed, as the ultrasound appearance of polycystic ovaries is very common in that age group but doesn't mean that they have the full syndrome. We also find that people from a Middle Eastern background or an Indian or Pakistani background will have an increase in prevalence of polycystic ovarian syndrome, which may be as high as 20 or 25%. And our own Indigenous population do have an increase in the incidence of polycystic ovarian syndrome as well.
For those people who may be experiencing it, what can be the symptoms that they might be feeling?
Often people are aware of their symptoms. If they are not having any symptoms, then it is quite likely that they do not have the full syndrome. Yeah. The common symptoms are irregular or no periods. And by irregular periods, that is defined by less than 8 periods a year, or cycles that are shorter than 21 days or longer than 35 days. The other symptoms include hormonal symptoms such as acne or excess hair growth, and then there are what's called metabolic symptoms as well, and this includes a very easy ability to put on weight, and there are increased risks of other conditions as well, such as cardiovascular disease, diabetes, and there's an association with an increase in anxiety and depression, unfortunately, as well. A number of these patients, mostly because of their irregular cycles and the fact that their eggs are not being released regularly each month, do have problems with their fertility. And as a fertility doctor, I see a lot of patients with that particular problem.
Is it painful, and how does it affect women who suffer from it? Does it affect their lifestyle?
It's very rare that polycystic ovaries cause pain, as the follicles that we're talking about are only a few millimetres in size. So they don't tend to cause pain. Pain is often some other condition other than polycystic ovarian syndrome. But the inconvenience of having irregular or non-existent periods, particularly when someone's trying to conceive, or the other features including weight gain and the hormonal symptoms do have quite an impact. And the other long-term effect, other than the increased risk of heart disease, diabetes, is that there is also an increase in abnormalities of the lining of the uterus if someone is not having a regular period, and that can put them at an increased risk of endometrial or uterine cancer, unfortunately.
How is it diagnosed?
The diagnostic criteria are that patients or clients need to have 2 out of 3 things to be able to be diagnosed with polycystic ovarian syndrome. One is the classic ultrasound appearance, and that is defined by equal to or more than 20 follicles on at least one ovary on ultrasound. The second criteria is that they have symptoms of irregular periods or irregular ovulation. And the third is that they have symptoms or blood tests indicating a hormone imbalance.
And so when should women seek help? Should they seek help early on, or should they wait till they're trying to fall pregnant and then realise, they're having a bit of trouble?
Really, if anyone has irregular or no periods for 6 months or more, they should be starting to seek some assistance to diagnose what is the underlying cause of that. Now, it may be that there are other causes, although polycystic ovarian syndrome is probably by far the most common.
Does polycystic ovarian syndrome affect your chances of falling pregnant?
Yes. So with patients or clients who have polycystic ovarian syndrome, they are not ovulating regularly each month. They may still get a period, as the period will occur once the uterine lining gets to a certain point. However, it will come away but not necessarily indicate that someone's been fertile. In polycystic ovarian syndrome, the signals are not being provided to the ovary in a coordinated fashion that lead to the egg developing and then being released. So this is where we need to focus our treatment, and that is also why the majority of patients with polycystic ovarian syndrome don't conceive, because they're either not ovulating or they're not ovulating predictably and they miss their window of opportunity. Unfortunately, there are other factors as well, and it may be that some of the weight gain that occurs as a result of the syndrome also adversely impacts on the chances of a patient or client conceiving.
What are the treatments, Rachel, for polycystic ovarian syndrome, and do they change over the lifespan of a woman, from falling pregnant into menopause?
Yes, it does. The condition does seem to be more prevalent, as I said before, in adolescents and under the age of 25. Now, these are often women that are not wanting to conceive, although they do sometimes wish to conceive, and that can be a problem that needs to be addressed. There are a number of treatments, and they consist of simple things such as weight loss and lifestyle support, specific nutritional advice, and we have dietitians that are able to support our patients with their diet and lifestyle changes to have the maximum effect of improving their symptoms of polycystic ovarian syndrome. Unfortunately, there is no cure. It is essentially about treating and managing the problem at the time. For a lot of patients or clients that I see, their problem is fertility, and we focus on that along with improving their lifestyle and their long-term outcome. and that often starts with ovulation medication, as that's the main problem with conceiving with polycystic ovaries. So the most common medication that we use to assist with ovulation is a medication called letrozole, and there has also been some benefit with a medication called metformin, and metformin works on one of the underlying imbalances within the body in polycystic ovarian syndrome. Other treatments include hormonal suppression if a patient or client is having problems with excess hair growth or acne. However, these treatments can't be given concurrently while they're trying to conceive. And if a group of patients do not conceive within 6 months of medication, we then start to look at assisting them with IVF or IVF-related techniques.
What are the supports available, Rachel? Obviously, Life Fertility Clinic is the place to go. Do people ring you up to make an appointment, or what should their first port of call be?
I would suggest that that patients speak to their GP. There are a number of clinics in Victoria. The Royal Women's Hospital clinic is one. There are also support services online with the PCOS support group Australia and Life Fertility Clinic Melbourne, and other fertility clinics are happy to help people as well.
Thank you so much, Rachel, for coming in to share all of your expertise. This is a topic that is not talked about enough, and we're so incredibly grateful from you and Life Fertility Clinic here in Melbourne for talking about this important topic. You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.